It's very important for us that Dr. Muchaweck joins the multidisciplinary team here in the hip and groin service. We have a lot of good people working with us in terms of rehab diagnostics, but ultimately a percentage of the patients are going to require surgery, and in my opinion Dr. Muchaweck is the foremost groin surgeon in Europe. She offers perhaps a treatment and a method of surgery that is not common in the UK, and I think it offers a tremendous opportunity for patients to access that in Birmingham.
I developed the minimal repair technique years ago, especially for athletes, because in my opinion there has been no surgical technique available which is really good for athletes to bring them very quick back to the field, back to full activity, and not to destroy the athlete's groin. So therefore I developed this technique which allows the athlete to come back to sportive activities within 2 days.
The main advantage of the type of treatment Dr. Muchaweck offers is that she performs a hernia repair and a repair to the painful area in the groin in the athletic patients that we see without mesh. So she just uses biological tissue, performs a double envelope, what we call a double envelope repair, so reinforces the back of the canal in the groin without using any mesh, which gives patients and athletes a lot more freedom in their rehab period, and we find that we can get them back up to speed, back up to their daily job or back to sport much quicker than we have done with patients that have used mesh.
In case of athletes, we are talking about small defects of the groin canal, around 2 centimeters in the circumference, and therefore I decided not to open the whole canal and to protect sound tissue, to keep the athlete away from a long time of pain and long time of being separate from recovery and from sportive activities.
Initially they'll be seen by a sports physiotherapist such as myself or Mark Gillett. We'll bring them through a triage service, and Mark, being the sports physician, will probably determine what investigations we need to do. It'll be my role to try and get some baseline measures and movement assessment and try and get to the root cause of why they developed groin or hip pain in the first place. I think a lot of physiotherapists perhaps zoom in on the painful structure straight away in the groin, but we really want to take an all-encompassing view of it and try and see what the root cause of the problem was in the first place through biomechanical and movement assessment. I think this service is going to be really important to anybody who works in both professional or amateur sport, and particularly in field-based sports where groin injury and groin pain can be particularly problematic. Once it gets hold and becomes established and the patient's had symptoms for a number of weeks, it can be particularly difficult to resolve. Here at Perform Birmingham, we've got 50 years plus experience in elite sport. We've got some of the top radiologists and investigative tools at our disposal to get to the root cause of the problem. So we're not just going to zoom in and focus on the groin pain itself, try and get to the root cause of it through biomechanical and movement assessment as well.